We're going to go over how to perform an occupational therapy evaluation. Anything within red boxes needs to be addressed. Let's get started. Patient identity always needs to be checked. Your time in, time out needs to be here. We do suggest a minimum of 40 minutes. Patient diagnosis and history. We will give you the medical diagnosis that will be within the yellow sticky that is by the patient's name within the hot box within Kinzer WellSky. You will select your own occupational therapy diagnosis. You will put relevant medical history, prior level of function, patient goals, and any precautions the patient has. Homebound status needs to be filled out and always checked yes, as the patient is homebound. We are performing home health. Criteria 1 is and or, so one of these boxes needs to be filled out, and you always need to specify below the reason for the homebound status. Criteria 2, this is and, so both boxes need to be checked, and you need to specify below reason for the homebound status. These are some good examples. You don't need to list all of them, but the patient does need at least one example. Social support, safety hazards. These are just drop downs. Please select the correct one for the patient and elaborate. Safety, sanitation hazards. Please check the correct box for the patient and elaborate below. Vital signs, you need to at least fill out the prior vitals with all the vitals shown here needs to be filled out. If you are unable to assess vitals for any reason, it needs to be filled out here, or if the vitals are out of parameters, please come below in the comments and select who you spoke with, be it the patient's physician or the nurse. Physical assessment, all these needs to be addressed, be it within normal limits. If there is an impaired status, please elaborate the reason for the impaired status as this note shows, orientation, and then give some elaboration below. Pain assessment area, if the patient does not have pain, you select this box. If they do have pain, please select the location, the intensity, and then you also need to fill out increased, relieved, and interferes with. All these need to be filled out. Do not leave them blank. The range of motion and strength section needs to be addressed. Please fill out to the best of your abilities. Do not leave this blank, and you can add comments here. The functional assessment, that's pretty straightforward. The biggest thing I suggest is do not leave any of these blank. Please fill out. A common error that people often make is they fill out the basics here, but they do not come below and elaborate on the deficits due to in comment section. This section needs to be filled out every time. It can be basic, but please do not leave this blank, and make sure you try to address all the above. And this is functional assessment continued. Again, do not leave blank. Please elaborate when necessary. Test and measures section. You check this blue box. It'll auto-save everything that you just worked on, so you will not lose all previous filled out information. You'll check this, and it'll open another tab. You need to fill out at least one test and measures. This shows measurable progress for insurance purposes. Please provide some elaboration here. Durable medical equipment, pretty straightforward. Check what the patient has, or they do not have any, but something needs to be added here. If there are needs, you can fill them out here. Now, just because you fill in needs here doesn't mean the patient is going to get it. We can always add a verbal order for equipment the patient needs, but that is separate. This is mainly I guess a reminder to yourself. Your evaluation and assessment goes here. Functional limitations, please check the boxes that are appropriate. Treatment goals, we have an entire video that goes over how to create these, update these, and address these with each individual visit, but you will add these by clicking this blue box here. Care coordination, please with each visit add some type of care coordination, be it intake team, if there's a coda attached to the plan of care, or if you do need to contact the nurse or physician, you will add this here by checking appropriate boxes, who you spoke with and what about. And then physician notified, if it is an evaluation, you need to always check this box. Statement of rehab potential, any treatment performed, and then your frequency goes here. As you can see, start date, end date. This was the date that the evaluation took place, and then the frequency requested goes here. So this is 1 time a week for 2 weeks, 2 times a week for 1 week. Discharge plan, check at least one of these boxes. If you want to save this visit as a template, you will check here and you will add a name, and as soon as you save the visit, it will create a template for you to use the next time you start an evaluation. And that is it. Please feel free to reach out if you have any questions. Thank you.